Paz de Dios y abrazo de Nuestra Señora la Virgen del Pilar. Eid Mubarak, kanyu katantan. Assalamualaikum warahmatullahi wabarakatuh. Happy Hari Raya. El Ciudad de Zamboanga está unido con la comunidad muslim y aquí entero mundo na celebración del Hari Raya Eid a mediante del pandemia de coronavirus. We thank our Muslim community in the city for cooperating and support our GCQ guidelines in line with the conduct of the religious gatherings in masjids, including the conduct of mass prayers Salatul Eid. May the grace of Allah usher happiness and harmony as well as healing in everyone's life. Our city streets were empty and quiet on the second Sunday of general community quarantine, yesterday Ascension Sunday, when no quarantine pass was honored except for emergency purposes. Gracias con todo que ta continua cumplir con el mga regulasyon mientras el ciudad y entero mundo te enfrenta con el pandemia de coronavirus. Buenas tardes a todos.
Buenas tardes con el diaton mga kompoblanos. Junto con el diaton alcalde este tarde para el diaton na virtual press conference, el diaton City Health Officer Dr. Dulce Miravite, el diaton City Disaster and Risk Reduction Management Officer Dr. Elmer Apolinario y el jefe del Zamboanga City Reformatory Center Jail Chief Inspector Nathaniel Anhas. Y ahora para con el mga pregunta del mga miembros del prensa, desde Teodiver Arquiza para con el diaton alcalde, ¿puede ba el gobierno local o el Task Force COVID hacer recomendación para deferir el abrida de clase aquí na syudad?
Sabi to Teodiver, el diaton League of Cities of the Philippines, el otro día, ya pidi ka natin survey si cuando kita quiere abrir klase. Para kumigo un maestra, I suggest that we open it on September 7, the second Monday of September, to give our school and parents more opportunities to prepare under a new normal. Na mga otronasyon, iabri sila eskwela pero very strict dila mga procedures on sanitation. And in the Philippines, since we also have our challenges, both materially and logistically, we will need time to prepare. That is why I would like to recommend, and we are open to your suggestions, that we open it on the 7th of September, the second Monday of September.
Tiene ba mga sanctions na mga barangay kaya man create mass gathering durante el distribution de arroz?
Well, actualmente, Teodiver, everything is under the executive order. That is why very recently, Ma'am Apple also spoke about the penalties of those who have violated our executive orders. And they have already been provided with a list of penalties that have been paid for.
From Julia Lipala, Mayor, why did the city government tap a single supplier for the purchase of rice and how much is the contracted price?
Okay, Julie, as it wasn't very clear, but for your benefit, we can invite Mr. Erwin Bernardo again to clearly explain to you in the most simplest term the procedures of Republic Act 9184, particularly on the utilization of government funds under our pandemic. The Department of Budget and Management has created a mechanism wherein they want the local government unit to provide a quicker means of supply for our people. Por causa deste, yung mga auto di aton mga vivientes, ya pwede tamen beneficia ng mga arroz kel gobyerno lokal ya dale. Por eso ta sige kita proseso in a single supplier, but everything I assure the public is subject to government accounting laws, rules and procedures of which you are also a beneficiary.
Mayor's reaction to the University of the Philippines study that in Zamboanga City the number of new daily reported cases is 10 per 1 million and the reproduction number, each COVID-19 case infects more than 3 other persons.
Based on the University of the Philippines projection, it states that by June, we will have more than 900 patients in the city of Zamboanga. All of these projections, I take it very seriously because we really have to battle COVID. As such, the recommendation also entails that we have to tap the different colleges and universities with their medtechs as well as medical and teams and nursing teams to also assist us so that we can fully contact trace and we can fully look at our barangay so that we will have the proper investigation and evaluation on the ground. For example, today, our team di aton of testing and contact tracing is not only composed of City Health or the DOH, we also have our participation of the nurses from the Philippine National Police. And this is an opportunity that we would also ask different colleges and universities so that we will really have to be able to test, to trace, and also treat. This is very, very important so that our numbers will not go up given that we expect more than 1,000 Filipino returnees, Zamboangueño returnees back to Zamboanga City. As what the IATF says and the DILG, kita gobyerno lokal, no mas ase mas difícil para kanila, but we will provide ample opportunity that they will be quarantined because we want everyone to have a very happy and safe reunion when they go back to their families finally in their houses. We need to treat, we need to test, and we need to trace.
Mayor, this is a question coming from our different members of the media, from Angelic Alejandro Brigada, also from Val Villaflor, and from Arjigo, with respect to the closure of establishments here in the city brought about by our ECQ and GCQ. Tiyan na ba ito ideya si Cuanto Bilog ang mga yan lugi o yasera per causa con este?
Angelic, Val, and Arjen, querido compoblanos, the city administrator's office provided us with the amount originally, but it is still subject to our careful assessment. Nonetheless, si Durante del Siege, pwede kita around mas de 50 million. I mean, yan, stop circulation. The numbers also vary in a way, but we would really want to also pump prime our economy para pwede kita ase otra vez subi con aquellos que queda affected during the atun lockdown.
As a follow-up question, Mayor, also from Arjigo and Val Villaflor, what assistance, if any, will the city government extend to those employees who have lost their jobs as well as to the businesses who have closed?
Okay, the city government of Zamboanga is coming up with our recovery and rehabilitation program. That is why the City Planning and Development Office has been working with our consultant from the UNDP that is trying to assist us so that we will be able to provide opportunities for those that have lost jobs and those that have whose businesses were affected. And my intention is to have this rolled out so that the public will know what the long-term plan of the local government is in order to rehabilitate our businesses.
From Angelique Alejandro, Mayor from Brigada, after May 30, man-extend pa ba kita ko ng GCQ?
Okay, Angelique, everything is dependent on the national government. Como enantel question kay subipal kaso de COVID aquí, para kung un gobyerno lokal, yo as alkalde, hindi pagat kita konfiansa que queda kita man live con el GCQ. Además, mas necesita pagat kita personalmente tiene di aton mga precautionary measures, especially when going out, because this is the new normal and we cannot go back to our old practices wherein we do not practice social distancing.
Mayor Comandante del Ciudad, cosa di tua reaksyon acerca la brida del clase ahora agosto?
Para kumigot, ablagane yo, si pwede lang abrigital klase na Septembre, kay tiene kita ambos tiempo que dale na mga diferente mga eskwela, el logistical needs deste, even el mga classrooms di atun antes, y mga bangko que tapalta. If we follow social distancing, that will really mean more classrooms and lesser chairs because we will have to follow the distances, and the Department of Education must prepare to protect our pupils and our teachers as well. That is why I would respectfully recommend if we can open it by September.
From Val Villaflor, Mayor, Balik Provincia is being promoted as in Metro Manila. Are there any Zamboangueños planning to return from Luzon, and what is your plan with respect to their jobs opportunities here in the city?
Okay, Val, sa kasalukuyan, ang ating pamahalaan ay nakapag-prepare na rin ng mga returnees from OFWs and other residents. The policy of the city government of Zamboanga through the Office of Tourism is to really have them quarantined and tested because we want them to safely go home to their families. With regards to job opportunities, it will be part of our package of compensations with the Department of Labor and the other national government agencies like the OWA to be able to assist those that have lost their jobs and have ended their contract. Aside from that, the city government is in our rehabilitation program so that our economy, particularly el mga buskabida dal diaton mga bibiyentes, ay pwede kita contribute para hindi sila sa lebyen lugi.
From Leti Militante, Mayor, porke kita man share ang mga medical supplies coming from the US Defense Force na mga ospital privado. Tan-charge sila ng mga pasyente for every single item, particularly ang gloves, pati ang face mask, porke hindi na government hospital sa dalit to help those in need.
Okay, Leti, el diaton donor, el Joint Special Operations Task Force 511.2, amo elya skuhi kung ken el mga hospital privado ke sila dale. The city government is only one beneficiary in the ZCMC. And we would also like, in line with your question, that these hospitals receiving them as a donation must not also charge our patients because the PPE and the other means of protective devices that are being used per patient is also very costly. The city government had opportunities of helping our private hospitals, and it was also very clear that these donations are also donations to help their indigent patients. Thank you very much, Letty, for your question.
I will be answering some of the questions. The Regional Interagency Task Force passed a resolution to dismantle our quarantine control points in the city proper per Zamboanga City Police Office. Is it not advantageous to us? This is from Albert Luna. Kaya lang kita klarifika, no, kay STLD aton na reglamento kaya pa sa El Regional IATF, amo sa mention na sa mga quarantine control points. Amo sa el mga lokaw na di aton mga borders, itya na mga portion del di aton syudad. Pero el di aton na Regional Interagency Task Force, ya asa sa men sa leun resolution, donde gane taabla sila kay el di aton mga gobyerno lokal pwede syempre mantene kunol mga security checkpoints establisaw na di aton syudad para checkya kunol mga quarantine passes. So nuay pa dismantling of checkpoints, como ya conversa kita, ya pregunta kita nante kunol di aton hepe del disaster office, under study pa itapidi pa sila tambien el rekomendasyon del policía local. Question tamen estaba kun Leti Militante acerca el supply na second wave of distribution donde gane chene un sako de arroz lang ya resibi inuay pa resibi mga delata i mga gulay. Ya pregunta tambien si kita kunal diaton City Social Welfare Officer iaablagan ele kay ya resultas de per causa ya palta el delivery chene mga biyahe man delay pero expecta kita kay na mga días que viene aumenta sila kunese chene sila lista del mga barangay kung quién sila ya chene falta mga delata y también el mga gulay. Now we will proceed to our City Health Officer, Dr. Dulce Miravite. Before asking the questions, she will first present the updates on our COVID cases. Doc Dulce.
Good afternoon, ma'am. Good afternoon, everyone. The cumulative COVID-19 suspect case we have for the city is 1,117, 142 confirmed cases, and 3 confirmed mortalities. Out of the 1,117 suspect case, 845 are with negative results and 150 with pending results. The total COVID suspect death is 132. Out of this, 59 have negative results, 15 with pending results, and 58 not done. 23 of the confirmed cases have already recovered. Out of this, 14 are PDLs, 3 jail personnel, and 6 from the community. 4 cases are admitted at Zamboanga City Medical Center. 2 of these have recovered for COVID-19 but are still on treatment for other medical conditions. We have 9 staying at our Adzulantaka Isolation Facility, 59 at EcoZone Isolation Facility, 86 at our CRC, 43 at Kabatangan Evacuation Center, and 15 at our Bucor Isolation Facility.
So for the questions, how is the state or status of the barangay officials and the barangay health workers?
They are stable, healthy, they are asymptomatic.
May we know how this barangay nutrition scholar got infection with COVID-19?
So she's a frontliner, el exposure di suyo, chanele high risk of exposure. And el area on the Ganilitan stay is near our epicenter. So pwede because of her work and her high risk of exposure.
From Julie Alipala still, out of over 100 positive cases inside the city jail, how many recovered? Is there still a plan for the city government to decongest the facility?
So we have 23 recovered already out of our confirmed cases, and 14 out of these are our PDL and 3 jail personnel. We are starting the decongestion by facilitating those who are given liberties already to be taken out of the jail to have them tested so that we will be able to facilitate their um, their extraction from the CRC.
Doc Dulce, what is your reaction to the UP study that in Zamboanga City, the number of new daily reported cases and the reproduction number are both very high?
The increase in the number of our cases is because of the increase in our testing capacity in the city, given that we have two laboratories already operational who we get our results. So we get our results also faster. And it just so happened that our epicenter is in our CRC, which is Chanekita Congestion Alley. So LD Atun rate of transmission also is quite high.
With August as school opening, has the city prepared for testing of all thousands of students and teachers in college down to primary levels?
By then, by August, by God's grace, we will have an additional two testing laboratory. So we're going to have four laboratories, which will really increase the Atun capacity for testing. So we will be able to screen more people.
From Angelique Alejandro, Doc, tiene ba otro mga barangay el estabaho na rapid testing?
So far, we are going to do the rapid testing na the Atun Zone 2 this week.
Kosal dito yung reaksyon acerca mga national report ke posible kada igual na Cebu el Zamboanga in terms of cases del COVID-19.
Sinira kita el caso na Cebu Alto because of also greatly nadiila active case finding. So, si Alto man el diaton kaso, that is because we are proactive, we are testing a lot of people, that's why we are getting more cases. Bueno man tamen ang sina el diaton kaso, no, we will be able to identify more so that we will be able to contain them earlier and to contain the disease from spreading to other people.
Doc, tiene ba kita nuevo dos recoveries adentro na Zamboanga City Medical Center? If yes, cuando sila man discharge y de donde si sila?
Actually, Chanekita, 4 cases admitted at Zamboanga City Medical Center, and out of these, gane, 2 have already recovered.
Okay.
To have recovered among sa L2 di aton PDL, but they are still admitted because they are being treated for their other medical condition. So, depending na management, del di aton mga attending physician na ZCMC, si Buenamente LD ila otro mga medical conditions, then pwede kanila man discharge.
From RG Go, I think this has been answered already. After Zone 1, Zone 2, LD Atun, next barangay. Free ba este testing, Doc?
C. LD aton testing araw, both for our rapid and our PCR tests are free.
Mga frontliners, kwanto bilog yamantes, como mga barangay officials si personnel, mga pulis, militar, hospital workers, si otro pa.
So there are a numbers of our frontliners who have been tested, especially those who have risk of exposure di aton. So, na di aton mga hospital, especially those who are taking care of our confirmed cases and na di aton mga that di aton epicenter gani iyang start kay kita man treat man test kunel di aton mga frontliners.
Tiene ba tu ideya, Doc, si cuánto el gastos del gobierno acerca con el diaton PCR y rapid test?
El di aton rapid testing, these are donations man. So, no ay kita gasta ali. El di aton allocate kita budget so that we will be able to procure 10,000 PCR testing kits. So, talisen na 10 million up el di aton budget for that.
From Albert Luna, Doc, based na record del DOH, Chenia el Ciudad 143 COVID positive cases. Tiene ba kita detalye del patient number 143?
Actually, este 143 yan check gani kita Sir Albert. This is because technically, este di aton 143 case is already recovered. El test ya recibi kita initial dos beses ko nila yan test, no? So, el second test is to you, which is already negative, amo kal kita una ya recibi. So, no ay kita kan kunele pwede kunta na di atun confirmed cases, no? So, yamira gani kita hunto na DOH that el previous test di suyo, el first test di suyo, el yan positive, but later yaya sa el deste resulta. They'll give you first swab. That's why ang sinakal no. So technically ara negative ya this your result and tan monitor kita because this is one of the PDL di aton given liberty this is one of the those given liberties already.
Tiene pa ba otro isolation facility ta prepara el ciudad para el posible second wave de infection?
So for the second wave of our infection, tan push gani kita na di aton mga kada-ekwalan barangay or clustered barangay to really come up with the isolation facility na di ila mga barangay.
Can we have a breakdown del 143 caso del COVID positive? Cuánto ya ba el yan recover na city jail and cuánto el still positive cases? ¿Qué tal también el mga pasyente na kabatangan isolation facility?
So ang mga pasyente di ato na kabatangan isolation facility are doing well. These coming days, man 14th day sila, no? So we are going to do our re-swab to them. And out of the confirmed cases di aton, we have 23 who have already recovered, meaning they have negative results already on their second test or yetsa niya sila uno negative result. So, out of this 23, tiyan kita 14 PDL, 3 jail personnel, and akal size is from the community case aton.
Okay, from Chodiver Arquiza, cuánto el gasto si tiene COVID el urgente from the use of the facility hasta na magamedicina si tiene con el tamanda toma?
So basically, el gastos del un pasyente si tiene COVID gani, no, will range at the very least would be about 30-50,000 or more. Mostly ta gasta gani kita because of our PPE. But since gani kita mga donations PPE, so medyo tan difficult di aton cost, no? But si kunta-kunta gat kita, depende tami na management or depende na manifestation, si grabe gat el pasyente, ta pwede intan sa milyon el gastos, no? Or a couple of 100,000. So it's very important that we keep safe.
Okay. So ahora ay pregunta también kita mga questions from for Dr. Elmer Apolinario, our City Disaster and Risk Reduction Management Officer. Dr. Elmer,
Wala sila.
Dr. Elmer,
Can't hear you.
Dr. Elmer.
with us.
Dr. Elmer, can you hear us? Maybe we will go on to Dr. Elmer after. Right now, we're going to ask our City Jail Warden some questions. Chief Inspector Alhas, na pwede tuwi ka namon?
Yes, sir. Loud and clear. I hear you.
Okay, thank you. So, Jail Chief Inspector, question from Julie Alipala. Out of over 100 positive cases inside the jail facility, how many recovered? Is there a plan for the city government to decongest the facility?
Yes, of course, no. Generally, i-correct natin yung figure. Hindi pa po tayo umabot ng 100 as we could recall the highest figure is 77. As of present, na-mention na rin ni Dr. Mirabite, nag-reswab yung 14, initial 44, 13 of them got negative. So out of 77, 64 na lang yung positive na PDL sa loob. Ang isa niya nung doon sa CCMC na nag-negative, kaya naging 14 sa report ni Doc. As to the decongestion, of course, we are optimistic that the city government will support as they have even issued executive order. One of the provision provides for that PDL prior to release must undergo swab test. And of course, we have our court orders. We are optimistic that so decongestion will possibly continue.
Sir Alhas, do we have an arrangement already for the Team Labas wherein hindi na sila uuwi sa mga pamilya nila after their duty? Na-swab na ba sila at ano yung result?
Of course, thank you so much for the question. In fact, we are implementing already. Thank you so much for the support of the LGU through our Mambeng, coordination with the DepEd. Na-accommodate na po yung mga team labas natin. Doon na sila nagstay, holding as barracks at Central School. They will no longer go home. Initial first batch swabbing po, nangyari 17 of them. So there will be a second batch about 21. The rest have already undergone swab test and some have undergone home quarantine. They will be reporting later on kung makomply nilang home quarantine.
Sir, kumusta naman po yung ating mga persons deprived of liberty, especially yung mga nag-positive? How are they coping with their disease inside the jail facilities? At kumusta na din po yung ibang mga PDLs at yung mga BJMP personnel?
Generally, yung sa nag-64 positive na PDL, isa doon mayroong symptoms na LBM as monitored by our nurses. Dalawa ang mayroong colds. All others, wala po. Even doon sa nag-negative na sa reswab, wala pong problema, wala pong symptoms. Although with medication yung mga nag-positive. Doon naman po sa mga other PDL, so far yung cell 20 natin na nilalagay natin yung mga may symptoms na suspect natin, nadagdagan lang ng isa, so 20 na doon nakalagay. For the whole week, isa lang na monitor natin. And other personnel, of course, dito sa loob, although init na rin konti kasi hindi pa na-implement ang changing of the guards, but nonetheless, they are doing their best to give the best services they could to contain the DC inside.
Sir Alhas, iklaro lang po natin no, para sa kaalaman ng ating yung mga nag-review ng ating press conference na yung sinabi ninyo kanina na 60 plus na lang po yung may positive cases. Ito po ay
64.
hindi pa 64, hindi po kasali dito yung mga PDLs na na-release na po. Tama po ba?
Hindi kasali
na po sila
kasi
kasali.
detain man sa detain
Sa
man
mga yung mga detained na lang po. Maraming salamat, Jail Chief Inspector Alhas. We are now excusing you from this press con. Thank you for your time, sir.
Gracias, gayon.
And now we will go back
Gracias.
to our City Disaster Risk Reduction Management Officer, Dr. Elmer. Are you with us? Doc Elmer?
Yeah, what is what you asked?
Yes. Doc Elmer, there is a question from Queenie Casimiro of ABS-CBN. Porque sin abiso el lockdown na Zone 1, insigidas lang, kelaya el maga necesidad y comida since quarantine pass A el Zone 1.
Well, aquel tiempo, durante del viernes pasado, it was a judgment call on the part of the officers concerned para asigar sa rekomendasyon, no? You know very well, kaya conviene kita man-address el public interest, so we had to make that decision, be drastic, but it was all for the good, for the best intention del Zone 1.
Sana naman daw po mag-update din about sa plano ng tourism at disaster office, lalo na si Mayor, hindi sapat na sabihan, I think, mga kerebolbe, Doc Elmer. Kere sila sabi,
Yeah,
si cosa bagayot el timeline del gobierno lokal acerca el bolbida di ila.
well, si kompleto mga requiremento, no, por parte ng mga requirements like medical certification, travel history, travel order, we immediately allow them into our city of Zamboanga. In fact, mucho gani pwede gani involve, no? Anoche lang gani, at yun gani kita yenta ka naton, the residente sa Zamboanga, 20 pwede entra, tiene tugo vessel, and este dia lang gani, if I'm not mistaken, dos aeroplano kaya liga, este dia Air Asia, kita kiarak, no? Taliba gani involve mga diaton, mga residente, pati residente ng otro mga lugar. So tablagan na kita, si kompleto mga requirements, sige lang el COVID protocols, por parte ng mga medical certification, pati el mga travel history, and of course, other requirements like mandatory quarantine, hindi ka sila pupunta sa Zamboanga, may problema. Todo kita taas kita naman facilitate. That's why, yung mga kung nga kita chinig mga numero mucho, yung itsyaga para ulit sila pwede man access. Na turismo lang, chinig kita tres numero, na Luzon, Visayas, Mindanao, hindi mo na opisina tamen, tenta sistema ng tourism office tamen.
Doc Elmer, in relation to that, siya question si Albert Luna. Kosabel update na diaton mga stranded kompoblanos. Kaya sa dogan sa Leun Orden, el diaton IATF, donde tabla, hindi pwede man deny kung el bolbida del mga locally stranded individuals with complete requirements, pending the release of Certificate of Acceptance from the receiving LGU. Ya recibi ba to el direktiba del DILG acerca con este? Cosa dito yung komento?
Sí, ito pa ugat sa do. Ay pa kasi mandato direktiba na DILG national ITF, no, para gani asigan esfuerzo para hindi mabolde kanila, no. El kung lang ito, importante lang kayo, na kay tiene lang kayo sa certificate, tabla kay si Snyder, a contact suspect probable or confirmed COVID-19 case, that he or she completed 14-day quarantine, amo lang sa mga requiremento. And then, once si kompleto, we immediately allow access. Unfortunately, kaya ito bolde kanila, kaya ito dokumenta liba. So that's why we have problems na border diyan.
In relation to that, Doc Elmer, siya question si Leti Militante, ko sa asistensya ba kita pwede dali kung este diaton makakompoblanos tali na otro syudad kay elos demás na tormentagan isa ka esed medical documents e-travel pass.
Amo nga rin, amo sigara, tapos ko na galing kita mga streamline, no, el mga requirements. Tapos kita coordination ng mga ahensya concierge, ng mga LGUs concierge, no, para dali kanila mga kita exit passes, and we coordinate with the respective DRM officers para dali el esfuerzo para poder saka sa mga requiremento. For our part, once they have that, we facilitate entry. Of course, tablangan kita it's really a challenge the part of the mga LGUs, but we are making headways. We're happy na chirigan na direktiba sa la noche, kaya naman naka-devolve basta, pero tasigi siyempre ng COVID protocols, which is very, very important.
From Tio River Arquiza, Dr. Elmer, ko sa base si tapone baho na lockdown el un lugar. Asigon ko nele, habla daw el chairman del Barangay Zone 2, ke hindi daw propio man lockdown kun el un lugar na di su barangay.
Well, the amon lang, no, when the assessment was made, it was based on health considerations, no. We sat down with health officials, it was discussed together with our city police, Joint Task Force Zamboanga, and it was a unanimous decision made on the recommendations that we had to have that area under lockdown. Kablagan nyo nantes, when we did that, we took the general interest of the city para bien de todo. Hindi lang para bien de un lugar, bien de todo, el pueblo Zamboanga.
From RG Go, Dr. Elmer, cheni aliga mga OFWs, kilaya el proseso kanila, kwanto persona este sila, y donde se sila aura, iyan test ba daw kanila?
Sí, anoche, Liga 38, ¿no? Todo sila, ¿no? 20 que de Zamboanga City, el uno de ellos, Basilan, 2 de Zamboanga del Sur, 4 de Zamboanga Sibugay, 7 de Zamboanga del Norte y 1 de Cotabato. So, mayor parte de eso se podía volver a la provincia, ¿no? Excepto por el Cotabato, que está aquí pa, el Zamboanga del Norte podía salir, el Zamboanga Sibugay, el Zamboanga del Sur, el Basilan, Anteaga. So, dito mga residente ara yung mga quarantine na kita dalang taka ka 20, no? So amo sa our city health officer is looking into that, seeing to it, checking on them kay manamental dila Australia.
Tiene daw gani kita siya diaton mga kompoblanos que tali na otro lugar. El pregunta di suyo, quién ba el gasta con el bolbida di ila el quarantine? Pwede ba daw ayuda el gobyerno lokal considerando kay mutya pasayagan sila difícil no financially, physically, and mentally.
Sabi man ustedes, i-check kita ka na si protocol kay mandatory quarantine. So, tiene kita i-offer sa kanila, katablang kita government identified quarantine, kung sila pwede gana estar, no? Na por parte de akil tablang kita mga gastos, libada kanina, tapi ko na kita gana si man-mount sweeper flights through the Philippine Air Force. In fact, we have already written OCD to help us out, manage el komunikasyon para na Manila, con el Secretario del National Defense para darle directiva con el Philippine Air Force Chief para darle ka na ese sweeper flights. Sweeper flights from CART, from Manila, from Cebu, and Davao.
Thank you very much, Dr. Elmer, for joining us. Y ahora uwi kita también el closing remarks y el aviso medical del Diaton City Health Officer, Doc Dulce.
So again, taab na kita ng mga di aton bibientes that with our increased testing capacity, so our cases might still increase, and aragan itsa ni kita our new recent case is the one from the community. So apila kita konel di aton mga bibientes to keep safe because there might be community transmission that's going around that with the testing facility in place, we will be able to get this coming days. So let us practice the aton social distancing, wearing of our mask until we will be able to be sure that no ay di aton hindi kita siya sustained community transmission.
Gracias, Doc Dulce. Kaya kita rin di gracias kung Doc Dulce, el Diaton City Health Officer, City Disaster and Risk Reduction Management Officer Dr. Elmer Apolinario, and the City Jail Warden, Jail Chief Inspector Nathaniel Alhas. Y ahora, uwi kita el mensaje de la Alcaldesa del Ciudad.
Muchas gracias, Attorney Kenneth Beldua. Querido compoblanos da Ciudad de Zamboanga, este crisis da demanda ka naton mga ciudadanos, Kristiyano-Muslim ilumad, ase unido el diaton fuerza para combate con este pandemia. The prevention and control of the spread of this virus through trace, test, and treat is the focus of our medical professionals. Let us support them in every step of the way, and let us continue to comply with the GCQ guidelines for our safety and that of our family and our loved ones. As we move forward to keep our people healthy and safe, the local government continues to manage the state of affairs and administer executive orders locally. In line with the Security, Health, and Education Program, we turned over 10 motorcycle units to the Traffic Enforcement Team under the City Administrator's Office to make traffic management more effective and more efficient. The authorities will continue the implementation of the No Parking Ordinance with towing operations to resume anytime. Enforcement of all other traffic-related laws and regulations in order to maintain law and order on streets while ensuring compliance with the required health protocols under the general community quarantine. Through the efforts of the barangays and CSWDO, the city government is happy to have served the residents of almost all the barangays as of today. We are now on the finishing touches of our second wave of relief assistance to the barangays. Gracias gayot con todo que hace posible este esfuerzo specialmente alya na barangay, LCSWDO, na distribusyon del mga relief goods na kada kasa. Kaya también kita as acorda con todo mga establecimiento de negosyo, el mga barbershop, salons y todo establecimiento bajo na Category 4 como mga gyms, fitness studios and sports facilities, entertainment industry, kid amusement centers, libraries, tourist destination and travel agencies, tour operators, reservation service and related activities, as well as personal care service no debe pa opera o abre bajo na GCQ. Este día tiene necrological service kay mañana ay el entierro del antes concejal Rodolfo Manuel Bayot. El disuresto ay tiene que livar el sangguniang panglunsod kan Attorney Beldua from Tumaga to Sangguniang Panglunsod where he served as councilor for 3 consecutive terms with the help of our people, and then he remains. The cortege will go to the City Hall, Fort Pilar, and Santa Clara Chapel of Tumaga kay Aligayot Elias Sirvi como Barangay Kapitan and will be interned at Forest Lake. Because of social distancing and quarantine protocols, measures will be taken, and I would like to express my gratitude to Father Merck Salatan and Father Louis Alejandro for accommodating the services for a very humble, dedicated public servant, great Zamboangueño, Councilor Rodolfo M. Bayot, who served with dignity and integrity, loving and serving LDCU mga beloved Compoblanos. Our condolences to the family, the entire city government, as well as our congressional representatives. May we emulate the life of Councilor Rodolfo Bayot in his love and dedication and service to Zamboanga City. Resibi kita mucho mga concerne acerca del diaton mga Zamboangueño kung poblanos que quiere agot volver na ciudad de Zamboanga. The city government has already made possible the numbers where you can coordinate so that we will list down the names of stranded Zamboangueños. It is a very clear directive from the Department of Interior and Local Government that local government units must accommodate our returnees, LD aton mga locally stranded individuals. With the City Tourism Office, we have received the first initial flight of AirAsia's maiden voyage today with the arrival of returning Zamboangueños, and it's also facilitated with the OWA. As the days go by, we will have more residents coming home, but we also have to be very clear that the IATF guidelines and health protocols must be also duly accomplished together with the required quarantine of which the city government must enforce. Porque kita taman requiri as pa-quarantine después de la quarantina kay hindi gani kita asiguraw kay mga quarantine measures that they've had nuay tene sila exposure on the way. We just want to make sure that the returning Zamboangueños are safe so that sila pwede volver na dila pamilya en buenamente to be safe and happy with their families. We will be giving you more updates and directives for returning Zamboangueños, and so that we will also be able to facilitate your return. Please know that since early morning last night, despite of the holidays, the city government has been working, the CDRMO, City Tourism, just to facilitate the arrival of Zamboangueños, and we have been doing so since we were given that directive early on. We want your return to Zamboanga an opportunity to welcome you home, but we would want to welcome you home to your families safe and sound. Otra vez, apela kami con todo kanaton para el mantensyon del di aton security and health protocols por causa kay el di aton COVID-19 pandemic es un enfermedad que pronto contaya. We appeal to everyone to continually stay at home and stay safe. Our deepest gratitude to all our medical team, frontliners, service providers, drivers, and even those in the groceries and other food chain industries that have been helping us, our utility workers, CDRMO, CHO, City Tourism, City Admin, and all the other offices, both national, local, and NGOs. Este si Alcalde Beng Climaco, asking and appealing to for everyone's support to continue practicing our safety measures. And kalor di amon na PIO and city events team, este si Alcalde Beng Climaco, thanking Sir Alhas, Sir Elmer, Ma'am Dulce, and Attorney Kenneth Beldua. Muchísimas gracias. In abrazo de Nuestra Señora la Virgen del Pilar y San Jose. Vaya con Dios a todos.